I will explain by selecting just 3 representative diagnoses. If injections treated, hair transplant surgery isn't needed, right? Hello, I'm Lee Sung-jun, Associate Director of Modumo Clinic Daegu. Recently, many patients seem to be contemplating hair transplant surgery and visiting our clinic for the procedure. However, it's crucial to understand that not all patients, regardless of their specific hair loss type, are suitable for hair transplant surgery. Therefore, today, we'll delve into the specific categories of individuals experiencing hair loss who should steer clear of undergoing hair transplant surgery. First, let's look at the types of hair loss that are not suitable for a hair transplant. If one examines hair transplant textbooks, they will find more than 40 distinct types of hair loss detailed, and for approximately 20 of these, hair transplant surgery is explicitly not indicated as the initial or primary course of treatment. I won't be able to go through all 20 as it would take far too much time, so I will select and elaborate on just 3 representative diagnoses. These 3 are commonly occurring forms of hair loss, and a significant number of patients diagnosed with these conditions often visit our clinic for treatment. Therefore, I'll explain these 3 conditions. The first one is alopecia areata. Approximately 10% of all patients diagnosed with general hair loss will be diagnosed with alopecia areata. Given its prevalence, alopecia areata is a condition that many people encounter, and it's quite possible that some viewers of this video may have personally experienced it on at least one occasion. Alopecia areata is an autoimmune condition. The term autoimmune disease might sound complex and difficult to grasp, so I'll simplify the explanation for you. Within my body, there are normally existing healthy immune cells. However, if these immune cells begin to assault your healthy hair or hair follicles, your hair will fall out, resulting in the development of hair loss. When alopecia areata occurs, it's because these immune cells have become active and are attacking your hair follicles, so we mainly use a drug called a steroid to reduce the immune cell's activity. Since alopecia areata can be treated with steroid injections, if it can be treated with injections like this, there's really no need for hair transplant surgery, right? Secondly, we have telogen effluvium. It appears that a significant number of individuals also come to our clinic seeking and receiving treatment for this specific type of hair loss. To grasp what telogen effluvium entails, you must observe the hair's growth progression and its inherent cycle. This here is the structure of a hair. Hair is created in the hair follicle and goes through a total of 3 stages: the anagen phase, the catagen phase, and the telogen phase, which completes its growth cycle. These long-growing hairs can generally be considered as predominantly in their anagen phase. After going through the anagen phase, when it reaches the catagen and telogen phases, the hair eventually falls out. However, due to severe stress or sudden drastic dieting, hair follicles actively growing in the anagen phase sometimes unexpectedly shift into the telogen phase. When this happens, more than a few strands of hair can fall out every day, and this condition is precisely what we call telogen effluvium. If stress is the underlying cause, we implement lifestyle corrections to address it. If the issue is a nutritional deficiency, we provide necessary nutritional supplementation. Through such treatments, telogen effluvium can indeed be sufficiently recovered, rendering hair transplant surgery unnecessary in these specific cases. The third condition we're discussing is trichotillomania. Trichotillomania is a disorder where patients, driven by repetitive obsessive thoughts, compulsively pull out or tear off their own hair. This leads to the development of hair loss. For patients with trichotillomania, if we conduct a hair examination at the hospital, we often discover evidence of hair breakage, resembling a rope that has snapped or frayed in the middle, and numerous individuals also present with patches of hair that have been torn out. With trichotillomania, cause-based treatment is key. Because the act of pulling hair itself needs correction, treatment is usually conducted at a psychiatry department, mainly through counseling therapy or pharmacotherapy. Similarly, with trichotillomania, once its root cause is addressed, the hair loss condition is resolved, making surgery unnecessary. In addition to these, as you can see on the screen, there are countless other types of hair loss that should not be treated with surgery. Also, among these types of hair loss, many are difficult to get an accurate diagnosis for until you come to a medical institution for an examination. Therefore, when you're experiencing hair loss, it's crucial to visit a medical institution, such as our clinic, that specializes in hair loss to receive an accurate diagnosis. Now, let's explore why hair transplant surgery is not recommended when diagnosed with the 3 types of hair loss previously mentioned, and what consequences might arise if such a procedure were undertaken despite these recommendations. For alopecia areata, telogen effluvium, and trichotillomania, treating the underlying cause of the hair loss is the top priority. If you undergo surgery or a hair transplant without treating these preceding factors, the problem will remain, and you'll just continue to lose hair. Conversely, if the preceding factors are adequately treated, that is, if effective treatment via pharmacotherapy or injections is implemented early, these are conditions that can be fully remedied without the necessity of hair transplant surgery. But what if, despite all this, someone with these types of hair loss gets a hair transplant? What would be the result? In cases of alopecia areata, even if you undergo hair transplant surgery, the relentless assault of immune cells will persist, causing the newly implanted hair to be reattacked and shed. Secondly, in cases of telogen effluvium, if underlying issues like stress or insufficient nutritional intake aren't managed and rectified, the transplanted hair might fail to thrive, or even hair that initially grew could revert to the resting phase and subsequently shed. Third, with trichotillomania, transplanted hair does grow. Although the hair will grow, if the patient repeatedly pulls out their hair once it has grown sufficiently long, the problem of hair loss will simply reoccur. In this video, we've explored the types of hair loss that are not suitable for hair transplant surgery. Since hair loss doesn't invariably qualify one for hair transplant surgery, individuals experiencing this condition should certainly visit a nearby hair loss specialist clinic or even our own facility to obtain a precise diagnosis and receive the most suitable treatment available. I will continue to upload hair loss information on Modumo TV so you can watch it consistently, so please make sure to watch the videos until the very end. This has been Director Lee Sung-jun of Modumo Clinic. Thank you.